Welcome. Let us discuss about sexually transmitted and contact disease, that is, leprosy. Leprosy is a chronic infection that affects the skin, mucous membrane, and nerves and causes discoloration, lumps, disfigurement, and deformities in the skin. This disease is caused by the bacteria called Mycobacterium leprae, which is slow growing. Leprosy is also termed Hansen's disease, after the name of the scientist Dr. Gerhard Henrik Armeur Hansen, who discovered this infectious disease in the year 1873. Leprosy disease has affected people on every continent. Almost 180,000 people all over the world get affected with leprosy. Children get more affected by this disease than adults. Leprosy is actually not that infectious, but it spreads when a healthy person comes in regular and close contact with nose droplets and leprosy patients. Leprosy is also transmitted through insects. Leprosy disease mainly affects the peripheral nerves, skin, upper respiratory tract, and eyes. The most prevalent possibility of transmission is through the respiratory route. Types of leprosy. There are three main types of leprosy. 1. Tuberculoid leprosy. Someone with this type of leprosy usually has mild symptoms, developing only a few sores. This is because of a good immune response. Tuberculoid leprosy is also called paucibacillary leprosy. 2. Lepromatous leprosy. People with this type of leprosy have widespread sores and lesions affecting nerves, skin, and organs. With lepromatous leprosy, the immune response is poor and the disease is more contagious. Lepromatous leprosy is also called multibacillary leprosy. 3. Borderline leprosy. This type of leprosy involves symptoms of both tuberculoid and lepromatous leprosy. Borderline leprosy is also called dimorphous leprosy. Symptoms. Although it takes 3 to 5 years for these symptoms to appear after coming in contact with the bacteria, in some cases, symptoms appear after 20 years of being infected. The time period between being exposed and the appearance of symptoms is known as the incubation period. If this period increases, then it is very difficult for doctors to diagnose the disease. It includes severe pain, bleeding nose, growth on skin, enlarged nerves, stiff, dry, and thick skin, ulcers on the soles of feet, paralysis or muscle weakness, non-sensitive lesions on the body, numbness in hands, arms, feet, and legs, eye problems that might even cause blindness. Treatment. Leprosy treatment fully depends on the type of leprosy the patient is suffering from. Antibiotics are used by doctors to treat the infection. Long-term treatment includes 2 or more antibiotics, which will carry from 6 months to a year. People suffering from severe leprosy may need to take antibiotics for a longer time period. But these antibiotics are unable to treat the nerve damage. There are some anti-inflammatory drugs that are used to control nerve pain and severe damage caused by leprosy. Paucibacillary leprosy. You will take 2 antibiotics such as dapsone each day and rifampicin once a month. Multibacillary leprosy. You will take a daily dose of the antibiotic clofazimine in addition to the daily dapsone and monthly rifampicin. You will take multi-drug therapy for 1 to 2 years and then you will be cured. Diagnosis. If you have a skin sore that might be leprosy, the doctor will remove a small sample of it and send it to a lab to be examined. This is called a skin biopsy. Your doctor may also do a skin smear test. If you have paucibacillary leprosy, there won't be any bacteria in the test results. If you have multibacillary leprosy, there will be. You may need a lepromin skin test to see which type of leprosy you have. For this test, the doctor will inject a small amount of inactive leprosy-causing bacteria just underneath the skin of your forearm. They will check the spot where you got the shot 3 days later and then again 28 days later to see if you have a reaction. If you do have a reaction, you may have tuberculoid or borderline tuberculoid leprosy. People who do not have leprosy or who have lepromatous leprosy won't have a reaction to this test. Complications. It includes blindness, kidney failure, muscle weakness, disfiguration of the face, infertility and erectile dysfunction in men, permanent damage to the nerves within the brain, permanent damage to the nose from the inside resulting in nose bleeding. World Leprosy Day is observed on the last Sunday of January every year. Established in 1984 by French philanthropist Rolf Fellero, it aims to raise awareness about leprosy and teach people about this ancient disease that is easily curable today.